The vast majority of my patients walk out of an HSG that I've done and they say, that was not nearly as bad as I was expecting it to be. Hi, I'm Dr. Batsheva Maslow. I'm a reproductive endocrinologist at RMA here in New Jersey. An HSG stands for a Hysterosalpingogram, which is a little bit of a mouthful. But what it is an X-ray dye study of the tubes. So the fallopian tubes are what allow the eggs to go from the ovary into the uterus. It's also very importantly where the sperm meet the egg. So they play a critical role in fertility. And understanding whether there is a blockage or swelling or some kind of abnormality of the tube is very critical as part of the infertility workup. So we use hysterosalpingogram, or an HSG, as our first line assessment of the tubes. And it's done by putting X-ray dye through the cervix into the uterus and then taking an X-ray of the pelvis. And that allows us to see whether the dye is spilling out the sides of the tube and whether there's any abnormalities in the shape or caliber of the tube. So an HSG is admittedly not the most comfortable exam. It's one that if you Google and you look on the internet, there's all sorts of scary things written about it, but it does not need to be so scary. Here at RMA, we do all of our own HSGs, which really allows our patients to have a more comfortable experience. It's something that we do many, many times a day, so it's something that we're very comfortable with and very familiar with, and we can kind of talk patients through what discomforts they may have. The vast majority of my patients walk out of an HSG that I've done and they say, that was not nearly as bad as I was expecting it to be. The HSG itself only takes a few minutes, and so you can be in the office really for a short period of time and then get up and go back to work if you'd like. So I generally tell my patients they can pre-medicate, so they can take Tylenol or Motrin about an hour prior to their exam. That will help with any cramping that might come from the speculum exam and from the dye that goes in. They can speak to their doctor and speak to the provider who's performing the HSG so they can get a sense of what's happening, and if they have any concerns or if they're nervous, they should speak up because as uncomfortable as it is physically, I think a lot of it is just the anticipation of it. And if we can alleviate some of that anticipation and help our patients feel more relaxed, the whole procedure and the whole test itself only really takes a minute or two. And so if we can get people to feel more comfortable about it, that's really important. So talk to your provider in advance so you have an idea of what to expect. And then kind of walk yourself through so you have a plan for the day. I would not say that everyone necessarily needs an HSG. It doesn't have to be universal. If you're in a circumstance where somebody knows they're going straight to IVF, which bypasses the tubes, or some other situation where the risk of tubal disease might be very low and it might be worth delaying the HSG for some period of time, it's individualized, or it can be individualized, but lots of women are going to need an HSG because it really does give us a lot of valuable information. Usually the provider who's doing the HSG can give you the results right there in the room. It depends on who's doing it and what your setup is, but when I do HSGs here at RMA, I usually will pull the images up on a screen and I'll walk through what I'm seeing with the patient. You may not be able to get the next step right then and there because your primary team is going to know best what these, how to utilize this information, but we'll be able to say, everything looks normal, or I see something that might be a little bit irregular and I'll want you to follow up with your doctor. It can be more uncomfortable when the tubes are blocked. If you imagine what we're doing is we're placing dye into the uterus and then we're taking this X-ray in real time. And if the tubes are blocked, the dye is going to stop at a particular point. And sometimes the tubes are blocked because there's just debris in the tubes. And if we give it a little bit of pressure, that debris will open up. Or the tube might be spasmed, and so it's not allowing the dye to pass. But if we give it a few minutes and then try again, we might actually be able to see that the tubes are open. So it can be a little bit more uncomfortable if the tubes are blocked because we're really trying to assess, are they truly blocked or is there something in the way? But again, even when the tubes are blocked, the whole experience should only take a few minutes, and that cramping should be relieved very quickly after the procedure is ended. There are obviously people who can have allergies to contrast, dye. If you are one of those where you know that you have that, you should be likely asked before you have the HSG when they're scheduling, but certainly you can bring it to the attention of somebody at the facility who's doing the HSG. There are preps that can be done to prevent an allergic reaction. It depends on the type of allergy and what the allergy has been to. So it doesn't necessarily have to prevent you from getting the test. And again, it will be a discussion between you and your physician about how necessary is the test. If my suspicion that the tubes are blocked is really, really low and somebody has a very severe allergy, I may decide that it's just not worth the risk of going through the HSG. Whereas if I really need that information for some reason, it might be worth thinking about doing like one of these allergy preps to avoid an allergic reaction. So hysterosalpingogram, if you break it down to the Latin, hystero is the Latin root for uterus, salpingo is the Latin root for the tubes, and gram means an image.